As we enter fall, we are also bracing for flu season. Health experts are reminding all of us it's time to get vaccinated again, not just against the flu, but other respiratory illnesses as well.
So joining us today is Dr. Desmar Walkes, the Austin-Travis County Health Authority. Thank you so much for joining us.
Thank you for having me.
So we know the public health emergency for COVID-19 ended over a year ago, but of course, coronavirus is still around. So talk to us about how you all as the Health Authority are responding to COVID and what should people be aware of, especially when it comes to vaccines.
So as part of our normal public health work, we're doing ongoing surveillance and making sure that we're seeing what the trends are in our community. And we're also continuing to provide vaccine for children at our Shots for Tots clinics, children who are ages 6 months to 19 years.
Yeah, and as we're all planning out what shots we would like to get and when we would like to get them, regarding the COVID boosters, can you talk about what's been updated with those?
So the COVID booster this year is a monovalent. That means it has one variant component in it that is representing what we're seeing circulating in our community right now.
Talk to us about, when we talk about the community, we know there's been a lot of skepticism over vaccines. What are you seeing here in Austin and in Travis County? Is there still that lingering skepticism? Are we seeing people be more accepting as we head into this respiratory illness season?
We're still seeing some amount of skepticism, but we have excellent staff at our clinics who can answer any questions that people may have to ease their fears and encourage them to get a vaccine to protect them. That's still the mainstay for protection against these vaccine-preventable illnesses.
Yeah, that advice still persists. So in addition to COVID-19, we've seen a number of people in our own personal lives have been contracting that here recently, but we also want to pay attention to RSV and the flu. Are there any expectations about how bad that season could be or if it could be mild? What do you think?
So we know that respiratory illness season brings with it those three variants of viruses, but also other viruses. So we have seen some forecasting that shows that we are expecting a season that is similar to what we saw last year, but that's all predicated on whether or not we have the same variant. If we get a new variant, it could be worse. So it's really important for people to take the time to make a plan to get vaccinated for this respiratory season.
Do you have numbers for, on average, or an estimate of how many people in the population take the vaccine for these illnesses or plan to?
So last year we had 20% of people who actually got the vaccine for flu, and that's low. And we had 9% who received that updated booster for the 23-24 season, which again is also low. So it's important that we make that plan to get vaccinated this year as we go into the season so that we can manage what we're seeing in our community and provide care to those that we need to take care of.
Do you think now is the time to get those shots, or should people wait a little bit to be able to see maybe if there's any kind of change to the vaccines? What's your advice about that?
We have the vaccines available now, and now's the time to go ahead and make that plan to be vaccinated. We typically start to see the flu rise in October timeframe. So making that plan to be vaccinated now is a good idea.
With a city the size of Austin, what challenges do you all face tracking the vaccines, getting numbers like those you had from last year, and also distributing them to the folks that do want to get vaccinated?
So the situation now post-pandemic is back to where we were pre-pandemic, and we rely on our local providers that voluntarily provide us with the information on how many people they're seeing who have the flu, RSV, COVID, and other things. We're also using wastewater to track what's happening in our community. But that is not the same as the day-to-day real-time information we were getting during the pandemic. And that's largely because a lot of people are also doing some home testing as well. So we are seeing trending, and we're using that to inform our decisions, and we're getting that information out to the public as soon as we can.
Yeah, and it's been reported that people can now request some tests from the federal government again to look out and check out for symptoms of COVID-19. But I just want you to highlight who is most at risk with these various viruses that we see in our community.
So it's typically the very young and those who are older or those who have chronic medical conditions that are most at risk for severe disease from these viral diseases like COVID, RSV, and the flu. And so getting a vaccination to protect yourself is super important for those groups.
Mm-hmm.
And finally, if somebody would like to get the vaccine, what's your suggestion about where to seek that out?
We have several providers here in our community who are providing vaccinations. They're also available at many of your major pharmacies, and of course, Austin Public Health has vaccines available at our Shots for Tots and Big Shots clinics for flu, for all ages, and for who are underinsured or uninsured. And we also have COVID vaccine for those children ages 6 months to 19 years. You can go on to vaccines.gov, and that will give you a listing of what vaccine providers are available near you.
That's good information for people. Dr. Walkes, thank you so much for joining us as
Thank you.
we head into this season. We know it's so important, these reminders, we just cannot understate. So thanks for joining us.
Thank you.
And we also want to remind you, you can find tons of simple ways to improve your health. We've got these on our website. Just look under the Simple Health tab at KXAN.com.